Pauline's coming to the clinic today. She's been suffering with some dry skin to the cheeks, nose and chin area. She does seem to suffer with rosacea, which she has done for a long time, which is a hereditary condition in her family. Now, main condition today was her skin has been feeling a bit sensitive due to the cold weather. So what we've decided to do is get her on a good product regime using some hydrating B5, really put the moisture back into her skin. Today we're just going to do a Firming Enzyme treatment. So it's really nice and gentle, there's lots of peptides in it. It will tighten the skin, reduce wrinkles, but it's not too harsh for this sensitive skin. So this is one of our daily essential cleansers. It has papaya and pineapple extract in it, which is an enzyme, so it will gently exfoliate the skin, so it's not too harsh. So when cleansing the skin, always work upwards. You don't want to be dragging the skin in a downward motion, because doing that twice a day for years and years will have a big improvement. So Pauline, what kind of things are you using on your skin at the moment?
Cleanser twice a day and some Q10 moisturiser day and night. Okay,
good. SPF?
Not at the moment, except when I'm directly in the sun.
So regardless if it's raining, cloudy, sunny, you must be wearing a sun protection. There are still UV rays penetrating the skin all the time. UVA, which will be aging of the skin, and UVB, which will burn the skin. Obviously at this time of year, there's going to be more UVA. So again, upwards all the time. So just giving your skin a really good cleanse. Okay, so I'm just going to show you here. Pauline has some facial broken veins, as you can see, around the cheeks and the nose area. Now, it is quite common when people have rosacea, they can have a flare up at some point. So if they eat spicy food, if they get very hot, exercising. Pauline was explaining to me before that when she cooks and she gets quite warm, then she does get a little bit more redness here. Now the reason I'm not going to do a chemical resurfacer or peel, I think it could be a little bit harsh for Pauline's skin. So we're going to be doing a Firming Enzyme treatment. It's got enzymes in it, so it will exfoliate the skin, but quite gently. It's tightening and it will help to reduce lines and wrinkles. So it will brighten her overall skin appearance up. I have suggested though she actually starts using some topical cream on these areas, and there's also some laser treatment that she's going to be actually having done as well to improve the rosacea. So this may feel a little bit cold, Pauline, so it's just the Firming Enzyme treatment. So we're just literally going to brush it across the full face. Okay?
Oh, it's cold.
Sorry. Okay? So this is just applied to the full face. It's a really nice gentle treatment. And then I'm going to get Pauline onto a really good product regime to start at home. So using some B5 hydrating serum, putting some moisture back into the skin. Daily cleanser with firming enzymes in it, and possibly one of our peptide creams, which is really good for anti-aging. And then I think a prescriptive product for the rosacea. So when people think of the term peel, they often think of Samantha from Sex and the City when she literally does peel. Now there are different strengths, different levels of peel. So this one is not a peel, this is literally just a firming treatment. And as I explained before, I've chose this for Pauline because she has got quite sensitive skin and rosacea. So the next level would be a resurfacer. So kind of does what it says on the tin, it resurfaces the skin. You can leave it on for longer, and there's different ones as well. So there's 6 different kinds, I think, of resurfacers that we can offer. So for pigmentation, for acne, general rejuvenation. Then we would move on to the stronger chemical peels, which we are going to get quite a bit more peel in there. So it does depend on the patient, from person to person, what they want to achieve, and how much downtime they've got as well. Some people may be able to have a week off work while they're peeling. They might not feel comfortable going into work. Some people might not mind. Everybody's different, and that's why your consultation is so important. Okay. So Pauline, we're just going to apply some B5 hydrating serum. So this is really going to put the water back into your skin. We all have hyaluronic acid in our skin. So this is suitable for all skin types: dry, sensitive, oily. It goes on really nice as well, and it soaks right in. You only need a really small amount if you was to use it at home. Just going to pop you some SPF on as well. So before you do have any resurfacers, you do need to prepare the skin beforehand. Depending on the colour of your skin, so if your skin's lighter, you don't need to prepare it quite as long. Darker skins would need to prepare for a few more weeks, just because the melanocytes are more active in the skin, so we need to calm those down by preparing the skin appropriately. So by preparing, we would use the Essentials cleanser, and also B5 serum at home, so the skin's in the best possible condition for the day of treatment. Okay, feeling okay?